Morning all. Well, 3 weeks ago we had 1,599 cases, and just 3 weeks later today I'm very pleased to be able to tell the community that we are down, still want it down to zero if we can get it there, but 667 today locally acquired cases. So it's quite a dramatic drop in the last 3 weeks. And I want to thank the community for all the work the community has done to make sure that they have followed all of the guidance from the public health team and ensured that this virus is reducing its circulation, particularly in the Sydney region. There are other areas of New South Wales that are of concern to us, and Dr. Chant will deal with those in a little while. There were 88,210 COVID tests to 8 p.m. last night. Cases in hospital, at the moment there are 981 COVID cases. 195 of those are in our intensive care units. Of that 195, I just want to stress that 140 of those people, unfortunately, were not vaccinated. 41 had received their first dose and 14 had received 2 doses. There are 93 people on ventilation in our hospitals, in our ICU units. We've had a number of people obviously pass away, 10 people, and 1 was in the age bracket of 0 to 9. 3 were in the age brackets of 10 to 19. What I will do is I'll ask Dr. Chant to go through those, but can I just say my condolences to obviously the families of each of those people who've passed away. Vaccination rates, incredible. At this stage, all ages over the age of 16 years, we've got up to 88.1%, 88.1% who've had their first dose, and of 2 doses, 66.5%. I want to thank our young people and their families. The youngsters who've only been able to get the vaccines in the last few weeks have come out in great numbers, and 56% of cases, 1 dose has reached 56%. 2 doses, of course, far less, at only 4.6%, but we expect that will rise rapidly. It's a big weekend for all of us. Not only reduction in the numbers, but a big game this weekend. So the Panthers and the Rabbitohs, can I just say, first of all I should say good luck to both teams. Incredible to have 2 Sydney teams in the grand final. But can I also say to their supporters, just be careful, please be careful. There are limits on the numbers of people who can currently gather together. You shouldn't be having people at home. Your home remains still one of the most dangerous places to be in terms of transmission of the virus. And we need to make sure that we all enjoy the game, but we don't have a super spreader event. We don't have all the hard work that we've done. You know, to have gone from 1,599 cases just 3 weeks ago to 667 cases today has taken a lot of hard work, a huge amount of work. Please don't ruin that. Please don't let the side down. This is a game that we all must win. It's a game where we all have to be winners. We have to make sure that this virus does not get a hold and come back in the numbers that it could do very easily if we ignore the rules and ignore the guidelines that our public health team have given us to keep us safe. I also just want to note that obviously COVID is going to continue to circulate in our community. Dr. Chant has said many times, as have I, as have the Premier, this virus is here to stay. It will be here for quite a while. We need to make sure that we all do what is necessary. Just be really, really cautious. Please be cautious. and follow the guidance and advice that the public health team have given. Today I'm very pleased that at Service New South Wales, and all of us can go onto the Service New South Wales website and get the guidance and advice about how we will progress in probably less than a week. Those vaccination rates that I gave you a little earlier indicate that we will probably reach the 70% double-dosed vaccinations by probably mid this week. And that means the following Monday is the day that we have our first removal of the restrictions. That's a really big day for all of us who have lived through the agony of this pandemic. None of us, I think, can wait. We're all desperate to get to that point. We'll be able to go back to cafes and to restaurants and pubs. We'll be able to gather with our friends and our family, but in a safe way, There will still be rules around that, which are rules set to keep us all safe. Rules designed to beat this virus into the background of our lives. Obviously, there will be limits in the various venues. The 4 square metre rule will apply indoors. It'll be 2 square metres outdoors for venues such as hospitality. There'll be access to gyms. A lot of us, even me, want to get back to the gym. But there'll be limits. There'll be class number limits and so on. Just please make sure that as we move to this next stage, have a look on the Service New South Wales website. It's pretty clearly set out there. Depending on what you're going to want to do, just make sure that you're sticking with the safety measures that our public health team are giving us the guidance on. I'd also just stress that obviously it will change again in due course when we get to 80% double vaccination. And that's going to be another important milestone in our battle against this insidious virus. And we will be making sure there's more information that goes up on the Service New South Wales website to clarify the progressive easing of these restrictions. I also just want to make the point that obviously we've set out a pathway, and the pathway looks to the future. But hopefully, if all of us can just stick with the guidance that we've got, we'll get there. But this virus is so dangerous that we also have to be alert to the fact that it could change. It could. I'm hoping it doesn't. I'm sure all of us are hoping it doesn't. And towards December, things should even get better. But of course, that depends also on the numbers and the cases. If we had a reversal because people suddenly decided that it was time to cut loose and be too free at a time when this virus is still waiting to take out particularly those people who are not vaccinated, that will be a huge challenge for us. I'm going to ask Dr. Chant now to give us some more information on some of the matters I've addressed, but also to give us some detail around what's happening in our regional areas, because some of our regional areas certainly have some challenges. And to the people who are living in those regional areas, I would just say to you that each of the public health team and the government are very keen to try and get you back to the position of freedom as soon as possible. But in some areas, I understand that there are restrictions, but those restrictions are to keep you safe, to keep us all safe. Dr. Chant.
So first, let me thank the 88,210 people who had a COVID test. We do want to see those COVID testing numbers increase and remain high for this next critical week. We want to find any cases in the community so we can take that public health action and prevent further transmission. Before we open up, we do want to see those case numbers as low as possible. So please continue to come out for testing. As the Minister has said, we're seeing a decline in case numbers in a number of areas in metropolitan Sydney, and that's pleasing, but we are seeing increasing trends in the regions. But our suburbs of concern remain Greenacre, Bankstown, Bidwell, Guildford, Yagoona, Bonnells Bay, Hurstville, Ingleburn. But we're also concerned about Wollongong, Newcastle, Maitland, Wellington, Oberon, Queanbeyan and Deniliquin, and a number of other regional and rural areas where we are seeing seeding and an increase in cases. Sadly today we've announced the death of 10 people, and can I pass on my condolences to their family. 2 people were in their 50s, 4 people were in their 60s, 2 people were in their 70s and 2 people were in their 80s. 3 people were from southwestern Sydney, 3 people were from western Sydney, 1 person was from southeastern Sydney and 1 person was from the eastern suburbs, 1 person was from the Wollongong area and 1 person was from the Nepean Blue Mountains area. 4 of the people were not vaccinated, 4 had received 1 dose and 2 had received the 2 doses of the COVID vaccine. And the 2 people who had received the 2 doses of COVID vaccine both acquired their infections in aged care facilities. And this highlights the fact that we still need, even if we're doubly vaccinated, the elderly still will remain vulnerable given their age, and it is important that we take those steps to protect elderly. A man in his 80s from Western Sydney who died at Auburn Hospital acquired his infection at the Hardy Aged Care Facility in Guildford, and this is the 5th death linked to this outbreak. A woman in her 80s from Western Sydney died at Campbelltown Hospital. She acquired her infection at the Northcote Aged Care Facility in North Parramatta, and this is the 1st death linked to this outbreak. There was a woman in her 60s from Western Sydney, died at Westmead Hospital, and her infection is associated with the Mount Druitt Hospital dialysis unit, which I have to say is in a separate building from the main hospital. And this is a 2nd death linked to this outbreak. There were 2 people who died at home. A man in his 60s from Wollongong area was not vaccinated and had underlying health conditions, and a woman in her 50s from the eastern suburbs had received 1 dose of the COVID vaccine, and she tested positive to COVID following her death. I'd just like to emphasise a couple of points. It's critical that you do get tested for COVID and you recognise that regardless of whether you've got chest pain, breathing difficulties, our health system is there to care for you. So please do never hesitate in calling for an ambulance and seeking health care. In terms of sewage detections, we've had sewage detections from Tweed, Kingscliff and Tweed Benora Point in northern New South Wales. In terms of Illawarra, that's an area where we have seen quite a significant increase in cases over recent weeks, and we do need to see that increased testing in Wollongong, Shellharbour. We've had 31 cases from Wollongong local government area, 13 cases from Shellharbour and 5 cases from Shoalhaven local government area. Hunter, another area where we're seeing increased cases. So there were 82 new cases to 8 p.m. last night, 25 in Lake Macquarie, 21 in Newcastle, 13 in Maitland, 2 Port Stephens, 1 in Cessnock, 1 in Mid Coast, 1 in Muswellbrook and 1 in Singleton. Central Coast has also seen 43 new cases, and southern New South Wales there's been 27 new cases. The 15 are in the Queanbeyan-Palarong region, 2 are in the Goulburn-Mullawy region and 10 are in the snowy Monero. And we've also seen a number of cases in Western New South Wales, 34, which is Wellington, Oberon, Dubbo, Cowra, Narromine, Burke, Goolgong, Mudgee and Bathurst. Northern New South Wales, we've had 6 new cases, 2 in Lismore, 3 in Tweed and 1 case in Kyogle. There's been no new cases in Murrumbidgee Local Health District, and there were 4 cases in Broken Hill. All are household contacts. In Mid-North Coast, there's been 2 cases reported to Mid-North Coast Local Health District, and both of the cases are from Port Macquarie Hastings local government area. 1 is linked to a known case and the source of infection for the other is under investigation. Southern Highlands, there's also been 2 new cases reported in Winter Carriby Shire. So my key message going ahead is please sustain those high rates of testing. Be particularly vigilant. We are seeing that increase in regional areas. And please go out and get vaccinated. We do know that there is access points through pharmacies. There is access through general practice and there's access through the state-run hubs. There is vaccine available for everyone, and as you're aware, regardless of your age, you're eligible for all 3 vaccines. Clearly the Pfizer and Moderna are those for that 12 to younger people. recommended for younger people, but the older age groups can have access to all of the vaccines. So if you've been showing a preference for a vaccine, now is the time to access that. We want to see those high rates of vaccine uptake across all age groups. We can't be complacent. We are going to need to have extremely high rates of vaccine coverage, and the more we can do now, the better we will have the experience as we open up in that October, November and December period. So thank you.
Dr. Chan,
Just on the rules.
Sorry, can I just clarify something? And that is, I perhaps moved a little too fast before. I just want to indicate that obviously there were 10 people who passed away, as Dr. Chan has just talked about, and again my condolences to the family and friends of those 6 women and 4 men. But I also wanted to just clarify that when I was referring to the cases with the young child, that is actually the ICU. The child has not passed away. And the child is aged between 0 and 9. These are the people who are in ICU. 3 are in the ages 10 to 19. 7 are in their 20s. 17 people are in their 30s. 35 are in their 40s. 49 are in their 50s. 44 are in their 60s. 35 in their 70s and 4 in their 80s in our ICUs. Dr. Chan.
Dr. Chan, just in terms of the changes for isolation status for close contacts of positive cases, it's obviously going to be changed now to isolate for 7 days, not 14 days. What's the health advice, or how do you come to that decision?
I suppose it's a balance that the risk of someone who's fully vaccinated is much less, and as the community becomes vaccinated, it's sort of a recognition of that, and also that we know most cases the majority of the cases will occur in that full first 7-day period. So it's just taking that risk assessment that in those settings, that those groups, if they remain well at day 7, have that test at day 6, then they've got a very little chance of becoming infectious afterwards. As a precaution, we ask those individuals not to go to hospitality, work from home where practical for the rest of the 7 days. So it just gives that added flexibility for those in recognition that fully vaccinated are less likely to acquire the infection.
Dr. Chan, if I could ask, these guidelines that have been given to us today, are these the ones that will carry us past December, or is it up to December? But also, when are the New South Wales Health Guidelines for businesses going to be released?
So these guidelines reflect businesses. So what these guidelines say is that for businesses and workplace, we give guidance, and that's basically a risk matrix that we've developed, and we'll continue to update that. So currently they're on the New South Wales Health website. There's some operational guidance for business in terms of determining who is considered to have close or casual contact. We will continue to refine those. We have learned a lot in partnership with business about how COVID is transmitted in workplaces, and we'll continue to reflect that in the upgraded risk matrix. There'll be some additional work on that risk matrix. It's a point in time, but we will also do some further refinements about indoor versus outdoor exposures that will then be updated and communicated to business.
And this is going past December?
So this will be the future that we're looking at for this period of 70 to 80%. But I think that everyone needs to understand this will be an ongoing reflection of what's occurring in the community, what are the lessons learned, what's the international experience. But we will be updating that operational guidance, and businesses will need to check every time when they're doing those risk assessments that around the updated guidance.
Dr. Chan, case numbers have come down today, as we've noted, but we have been told, obviously, that as soon as we open up, they are going to hit the roof again or skyrocket. What is the sort of number that people should be expecting that we need to be comfortable with that case numbers could go to again?
So look, I've said this before, one day does not make a trend. We're very conscious of the weekend effect, and every weekend, if you look at the graph, it's sawtooth down. So until we get to probably Wednesday or Thursday this week, we won't have a real sense of where we've landed. But the data does show us that we are, that we've got confidence that we are seeing those real declines, particularly in those areas of southwestern Sydney and Western Sydney, but still quite high rates. And so I don't want any complacency in those communities. And whilst they've done a brilliant job in getting vaccinated, there's even more work to be done. I think that going forward, what we're going to have to see is how do case numbers correlate with hospitalisation. So we do know that we will expect some breakthrough infections in people that are fully vaccinated. There's still a lot to learn about how infectious people are that are fully vaccinated, whether there's any changes in their ability to transmit and in what settings. So we've still got a lot to learn about Delta. But in terms of the things we'll be particularly minded to, it'll be case numbers, but it will be more importantly how we're seeing that translate to hospitalisations and impacts.
But as we enter that stage, that very busy potential stage for hospitals, is it the case that ICU beds will be rationed, that there'll be guidelines indeed around we get to bed?
I think I've made this very clear that we have choices going ahead how we want to open up, and I want to do so in the safest possible way. So part of the strategy is we're only having vaccinated people interact with vaccinated people, which is a significant risk mitigation. We're doing the 1 per 4 square metres. We're trying to preference outdoor environments, and I would urge individuals to make their own risk assessment. If you're elderly, please, and you're taking your mum or someone with underlying health conditions out and you're doubly vaxxed, I would still be preferencing an outdoor eating table if available. So I think that we need individuals to realise that even if you're fully vaccinated, if you've got underlying conditions or elderly, you're still going to be more vulnerable if you get breakthrough infection with COVID. I'm hopeful that if we can push our vaccination coverage as high as possible, that whilst we might see case numbers going up, we can actually see hospitalisations and ICU admissions remain relatively flat. But we have choices. There are still a large number of people that are not vaccinated. In some of the LGAs that we've been having a strong focus of when I've reviewed the data over the weekend, we still have areas that are disproportionately under-vaccinated, and some age cohorts, some age groups that are still vulnerable. I'm urging young people, but I'm also urging any of the elderly and over 60 that may have been hesitant to really redouble your efforts and engage. You've got access to the full suite of vaccines, both AstraZeneca, Pfizer and Moderna, so please go forward and make that booking as soon as possible.
Some of the close contact rules are obvious. If you live with a case, you are a close contact. Some of them are a bit of a grey area. So what does somebody do, for instance, if a friend of theirs has tested positive and they've been at a picnic with them and it's outside and they've had masks on and they're all vaccinated, is that a personal assessment thing, or would you recommend, more than 15 minutes contact with them? Is there some more guidance you give around that where people need to realise that they are a close contact?
Certainly we will work at giving some practical examples, but I think what we're saying is if you've had a friend over to your house and you've been chatting without a mask in an indoor environment for a couple of hours, then clearly you're a close contact. I think if you're out in an outdoor environment where you're having a picnic and you've been socially distanced and everyone's fully vaccinated, then I think that presents a much lower threshold. So we will develop some scenarios and some examples, but as you know, it's impossible to describe everything. We are going to require people to apply some common sense and caution. I think that we really do recognise that aged care facilities, healthcare facilities, disability group homes and some workplaces are highly risky for COVID transmission. And so we would expect individuals who work in those settings to even be more cautious in getting a test or taking that next step in making that assessment, personal assessment themselves.
Dr. Chan, with the hospitalisations, they seem to be trending steadily down. We're under 1,000 now, and ICU cases have fallen under 200. Is this diverging away from the modelling that was released, and is it surprising you that this is happening?
I think the message is that we know that public health measures associated with vaccination works. That's the underpinnings of the national plan. I think it's pleasing to see it play out, but we need to do more. We still we're around 86 to 87% first dose vaccinated. Let's drive that up to over 90%. I'm expecting to get 90% first dose. I want to see that continue. And we know that this next increment of getting up every percentage will be harder, but I do call upon the community. Reach out among your friends and family. Anyone who is having difficulty getting a vaccine, help them to get vaccinated. There are increasing access points, and I do not want to leave anyone behind, people that might not have access to cars, people that might not be able to navigate public transport or navigate the website or the appointments. Help them, and let's get everyone vaccinated, and let's aspire for the highest vaccination coverage ever achieved.
I guess the question. Thank you. I guess what I'm saying is, with the hospitalisations, are you still expecting hospitals to be overwhelmed as per the modelling late this month, early November?
So at the moment we've seen hospitalisations track down, and we've seen ICU admissions track down. And so that's pleasing. The modelling will be rerun based on that, but they are tracking beneath the modelled estimates. But I do not want anyone to be complacent. Once we open up, if there's been unrecognised transmission, people are going to be let their guard down. There is a risk that we see an increase in cases. What I would love the community to do is continue to get vaccinated. That last push for vaccination coverage is going to be one of the hardest. As I said, I'm very committed to make sure we do not leave anyone behind and make sure everyone's had an opportunity to be vaccinated.
With people being treated at home, and perhaps this is one for the Minister more, are we going to see people with limited or no medical credentials or background involved in checking on those cases at home? Is that a plan at any time?
No, I think that as we move forward with how COVID care is delivered in the community, there's lots of discussions around how we engage general practice more strongly in the care of individuals. But there's a triage process where we assess people as high risk, medium risk, lower risk. And for the lower risk, there's often a checklist screening for those lower risks, some information that's provided to them, and then there's clinical governance and escalation for anyone with any issues. But this will be how we develop our models and change our models for care in the community will be an ongoing discussion, and I know that there's a lot of work being done with our clinical communities to look at how we can work with primary health networks, GPs, as well as other providers to make sure we've got comprehensive care. But I just would like to urge everyone, people with COVID can have chest pain, other incidental issues. I just want to get a message out that our health system is able and willing and there to help you. The last thing we want to see is people not reaching out. As you've seen, many doctors have presented at these meetings and all of them have had the message, we would rather see you sooner than later. If you present early, raise your concerns early, we can provide the best care. But sometimes, if you delay, there can be dire consequences. So please know our health system is there to care for you, and please continue to get tested and never be concerned about putting pressure on the health system. Always ask for help. We're there.
Minister.
Just in terms of business, what's your message for businesses? There's been a lot of concern about policing this. We know that the police aren't going to walk through. You suggest there are still fines though for businesses for not complying with the vaccination rules.
Look, businesses need to understand that there are obviously very strict requirements that are laid down under the public health orders, but also under just generally their occupational work and safety requirements. So they should be doing what they can to keep their workplace safe. They have an obligation to their employees and, of course, to people who come through into their businesses. But it isn't, I'd like to think that this is not about enforcement. It's about making sure that all of us together do what we've done so well. Why are we actually now in the position we are? Well, we're in a very positive place, heading in into an even more positive place, because businesses and individuals have all worked very, very hard to get vaccinated and to make sure that our community is safe. I have no doubt, by the way, I know that it was occupying some attention a week or two ago about what the police role will be. The police role will be if somebody is coming into, for example, a retail outlet or a hotel and not presenting their evidence as is required of their vaccination, then of course the business proprietor or the person on behalf of the business proprietor will make a call to the police, and the police will then come. But you can't. As Health Minister, I don't and wouldn't expect, and I don't think we as a community would expect, the police to be at every facility or every restaurant or every retail shop. That's not what they do. They're there to keep us safe from other aspects of, unfortunately, criminal activity.
Minister, can we be certain...
Sorry, I'll just come to Ursula then you. Is that right? Yep.
Minister, can we be certain that the roadmap that has been set out for New South Wales will remain the same no matter who is the leader of the party?
The roadmap has been very carefully worked on by the entire public health team, and it will definitely stay the same unless, of course, circumstances change in terms of the numbers of the cases. It will change only in a sense if there's some medical issue that requires it to be revisited. But that's happening all the time anyway. We've been working on, I mean, I think this is about the 21st month that we've been working on all this, and I've been spending many hours in this building with Dr. Chant and the entire public health team. It changes when we need to change the maps forward, but there's no other reason. If you're referring to the fact that the Premier is not going to be part of that team, I have to say that she has been absolutely critical to the team. She's on some days she's been in this building, as I'm sure Dr. Chant would confirm, for 8 to 10 hours working with the health teams on all of the detail, and for that we are, and I think as a community, forever grateful to the Premier, to Gladys Berejiklian. But that doesn't mean that the health team and the rest of the government won't continue to do what we need to do. In fact, in the last 24, 48 hours, I've had discussions with a number of senior ministers about a number of health issues. We are focused on trying to make sure, our government is very much focused on trying to make sure our community stays safe. There are some issues being sorted out, obviously, at the moment, but each of those people who are involved in the particular issues at the moment politically are also talking to me constantly about the health issues and keeping the community safe, as you'd expect. Sorry, could I come back to you? Come back to you in a sec.
Have you spoken to Gladys Berejiklian? How's she doing? And a quick comment on Andrew Constance.
Look, I don't intend to comment on personal contact or discussions that I have with my colleagues. That's not appropriate. What I would say about what I would say about the Premier is that I think she has been an amazing Premier, a person of high integrity, and somebody that I would place my trust in completely. And I think that's what the community of New South Wales has done as well during these last 20 months. And you know, it's just awfully sad that it's come to this situation. Sorry, can I answer the question about Andrew Constance? Look, I only was advised that had been publicly announced just before I walked in to the press conference. But Andrew has been a stalwart. He's worked very hard as a state minister. He has, he's sacrificed a lot of himself for the community that he represents. No one could forget Andrew's sadness and his passion when there have been terrible events in his community, not just the pandemic, but also the bushfires. He might have been fighting the fires on his own front doorstep, but he was also fighting the fires and supporting the community, of his broader community. So Andrew, whatever he does, will always be a very major contributor to his community. And I hope if he does stand for a federal seat that he is successful in that. Sorry, come back to Lucy and then to you, Chris. Yep.
We're at one of the most critical points in this pandemic. We're on the precipice of opening up, and on 80% we're going to be, there's an ICAC inquiry being held and the Premier will be fronting, the former Premier will be fronting that. How much of a distraction do you think this is all going to be, and this leadership challenge is going to be as we try to move into the next stage of the pandemic?
Look, ICAC has a job to do. It will do its job. Any discussions about whether or not the ICAC is doing its job appropriately are matters that I won't canvass. As to the work that goes on in government, the New South Wales Liberal and National Party's ministers are very committed to looking after the community. 99.999% of the time the discussions are about our community and getting the best for our community, and that will continue.
Do you want to stay on as Health Minister under the new Premier?
Thank you for asking that, Ashley, but that's a matter for the new Premier, whoever that be.
Who will you be supporting on Tuesday?
That's also a matter for the party room, not for the media. But thank you for your interest.
Minister, do you believe we will have this decision sorted out before Tuesday's party room meeting?
Look, I think historically these matters do tend to get sorted out before the party room meetings, so I would anticipate that there's a fairly good chance of that, but time will tell. The discussions that take place are part of the democratic process, and it's part of what any government does when there's a change of leader. So I've been there for a few of those, and I think that there's nothing to me that's happening at the moment that should cause any cause for concern. It's happening the way it should happen. But ministers also, I can tell you, as I've said before, are concentrating on what is in the best interest of the community. As I said, I'm here today doing what I've been doing for 20 months, and other ministers have been discussing the issues around the pandemic with me in the last 48 hours. So that will continue.
How much sway,
Sorry, Chris.
How much sway would John Howard's endorsement of Mr. Perrottet have with the rest of the public?
Look, everybody's entitled to a supportive position and to make commentary. Personally, I think Mr. Howard is one of the greatest prime ministers and leaders our country has ever had. Various people will make their comments, and that's exactly what happens in a leadership issue. But I'm not going to say anything more than I personally have a high regard for John Howard, and I think that the community have.
And Mr. Perrottet will make a fine replacement, would he?
The candidates that we have who have announced so far, they are all fantastic, capable, intelligent, caring, compassionate people who would do a first-class job as the Premier of the state.
Minister, the Treasurer, though, has had disagreements inside Crisis Cabinet over the direction and over certainly over the tale of two cities issue, where we have the LGAs under one set of restrictions and there was a chance that they were going to be kept under that at 70%. He has disagreed on policy.
Sorry, I'm not going to get engaged in that, Ursula. I've got to say that so far the two candidates, both Minister Stokes and Minister Perrottet, I work extremely well with both of them. They are both members of the Crisis Cabinet dealing with the great challenges that is around our pandemic. They are both caring and compassionate people with great skill sets, and they'll do a great job. Either one of them would do a great job, and if there's another candidate, well, we'll look at that too. But at the moment, they're the two candidates.
Dr. Chan, can I just ask one question, please? Minister, do you mind?
No, it's fine.
Dr. Chan, I expect you to be a bit reticent about answering this question, but under any estimate, you've had a unique and incredibly successful partnership with Gladys Berejiklian. How did you feel on Friday? How do you feel now?
I suppose I'll address that question in my own way, which is just saying that the Premier has worked tirelessly since the pandemic commenced through this most difficult time, and I think her clear commitment to the community is so evident, and I don't think it's really appropriate for me to go into any further issues, but just to recognise how hard and how committed the Premier has been.
Were you feeling devastated on
Again, it's not appropriate for me to comment. I'm focused on delivering on the roadmap. For me, this is a very critical phase, and I am, there's many times through this where we have drawn on the community to do the right thing, to business to do the right thing, and for government to provide that supportive framework. And I'm just trusting that the community and business and government will work together to see this transition in the safest possible way. But there is still a lot of work to be done, and all of us have to keep focused on that task so that we can transition as safely as possible and also not leave anyone behind. And this is my key call out, to make sure we've done everything we can to help everyone get vaccinated, because that's the single most important thing we can do at this time.
Could I ask you about this, Michelle?
So casual contacts in the business setting will still be there, and also there are times where we will give you different health advice in different settings. So in things like other settings like childcare, aged care, or other special settings, we may give different advice. So sometimes it might be get tested 5 days after exposure or do other things. So this simplifies our approach, but there will always be those special settings where public health will continue to give that advice that may differ and is tailored to the particular circumstance, and also in regional areas where we've got particular focus on towns. Again, there might be some additional advice in particular settings in regional towns.
Ask about booster shots, the prospect of them before Christmas, and what kind of message could that potentially send to those who haven't even had their second dose, if that is what occurred?
Look, ATAGI is considering the need for boosters, and what they've flagged is they're first considering that for those with underlying health conditions, which mean that they're less likely to get that adequate protective cover from 2 doses. We do know the vaccines are very effective, and certainly someone without those underlying health conditions will generally have a very good response to the vaccine. I'm anticipating that ATAGI will come out with that advice about which groups require a booster dose. It's pleasing to know that vaccine supply is no longer constrained, and I think we would be seeing general practice, pharmacies and our own health services work to get those booster shots administered as soon as that guidance is issued from ATAGI.
Minister, how can you give an assurance today and a commitment that the roadmap will stay the same at 70, 80 around December 1, where we don't know who the Premier is?
The government has worked to ensure that the roadmap is worked on through our public health team and the crisis cabinet. And the crisis cabinet actually has a consensus way of reaching decisions. I can't imagine that there would be any change except for health reasons. I just can't stress enough that the government is still the government. It is still operating in the interests of the community. It is still working, right as we speak, in relation to the pandemic. And we will continue to do the job we were elected to do. I mean, I know the media like to find some excitement about such issues, but it's a very mature approach. We live in a very mature democracy. But don't get me wrong, in terms of are there feelings of sadness? Yes. To me at the moment it's a very sad situation, and I feel so sad that the Premier is not going to be the Premier after Tuesday. She has done a job which has just been unbelievable. But at the end of the day, she would be the first person to say that our government must continue to govern for the community. And we all know that. We've heard that from her so many times, that there's not one person in our government who won't be doing everything absolutely for the community going forward. This roadmap is part of that work and commitment, and it will be only subject to change if the health advice is such that it should be changed.
If Darryl Squire was here right now, Minister, what would you say to him?
I have nothing to say.
Minister, the allegations, however, that are the subject of this ICAC inquiry are very serious. What do you make of those allegations being levelled against a Premier you hold in such high esteem?
ICAC has its job to do. I think there's been a lot of discussion in the last 24 hours about whether the model is the appropriate model that should be going forward, but it is the model we have at the moment. And it has a job to do, and the people there will do their job. I don't think it's appropriate for me to add to that, except to say that I'm listening intently to the community's view on what we need in terms of an ICAC. We do need an ICAC. There's no question that we need an ICAC. But whether it should be a model that is much closer to the Hong Kong model, where these matters are dealt with behind closed doors until there is actually definitely a case, a sufficient case, is a matter that I think the community will look at and are discussing. But they're not those issues are not issues which we are focused on now, and nor should we be, even though you might want that.
So you agree that all of this has brought forward now the real need to debate reform to the corruption?
I'm not going to add anything further to what I've said. I've observed that the community themselves are out there having that discussion, and certainly it's fair to say I have strong views as a former Attorney-General in relation to how ICAC should operate, but those are views which are best left for our party and for government to discuss in due course, and for opposition and for everybody, the community, to have that discussion. Cool. Thank you very much. Sorry to have to drag you on a long weekend, but thank you very much. Thank you, everybody.
Soccer.